The APD tester can also help quantify the amount of the APD defect. The LED lights can be dimmed in steps. The levels are calibrated to the same level as standard neutral density filters. So if you detect the positive APD for the right eye, then you would start dimming the light corresponding to the patient's left eye. You would keep going until you reverse the APD. Then you go back one step at a time to find the best level where there is no APD. I will demonstrate that here. So let's say you have found an APD. Now you're going to dim one of the lights to the point that it would reverse the APD. You would do so, let's say the light that you want to dim is this one. So we're going to hold the opposite two buttons together. It flashes a couple of times. Then you press the button sequentially, and you can see the light dimming each time you do that. The level of dimming is present here. So you can see the scale, but it says full, and then there is the level 0.6, 0.9, and 1.2, 1.5, and 1.8. These are the same levels as neutral density filters. And you can actually keep going until you find the right level. So once you have decided this is the correct level where there is no APD present at this level, then you can record it on the patient's chart. For example, in this case, it would be 0.9 log units are APD. And then you would say which eye was the defect in. So at this level, one light is dimmer than the other one. This is dimmer. And you can go back to the normal setting, the previous setting. If you hold all four buttons together, the lights flash, and then both of them are now full. So that's the full original state. This is much easier than using a neutral density filter in the traditional swinging flashlight test, where you would cover the eye and you could not see the pupil you're shining because the neutral density filter also blocks your own view. There are two other lights incorporated in the APD tester. These are controlled by the buttons in the front. So the back buttons are close to the oculars are the white lights, and the front button actually controls the other light, which happens to be a blue UV LED light. And there is both sides. They are designed for examining the cornea or conjunctiva after instilling some fluorescent dye. This is useful for when you don't have access to a slit lamp and there is some complaint of a red eye or painful red eye. And this would be, for example, in nursing homes or hospitals bedside testing. And since it's a portable device, you can take it with you to these settings. Or even in the office, if there's a room that doesn't have a slit lamp, you can easily check for these things. Just put a little bit of fluorescein and you can decide, because it's magnified and the UV light, you can decide if it's a corneal foreign body, maybe a corneal ulcer, or just an aberration. One last thing that I found useful in using this device is the ability to take photos through the oculars. So I generally use my cell phone and take a quick photo from an external part of the eye, eyelids, and maybe the part of the conjunctiva or cornea. And this photo, along with the report, qualifies for the billing code 92225, or external ocular photography. So I use this device on all my patients. It makes me feel confident about my pupil testing. The website apdtester.com directs you to the two versions of this device. One version is a detector of APD, and the other has the capability to detect as well as quantify the APDs. Thank you very much for your attention.